I'm Dr. Leela Mohan. I'm an MD physician. I practice diabetes. I have my own center in HSR Bangalore that is called as Padithem Healthcare, and then I'm consultant in motherhood and Columbia Asia on Sarjapur Road. So the very good diabetic meal plan is usually try to avoid the rice. So that is the first and most important thing, and then the excessive eating of fruits or excessive eating of ice creams also to be avoided. And when we come to foods, the list of the foods which usually we have to avoid mainly in the diabetes is mainly the cooked carrots and corns and potatoes. Potatoes are mainly which consists of rich in carbohydrates, which should not be consumed more quantities when a person is suffering with the diabetes. And as usually I had told, rice you can avoid, and then sweet potatoes and bread crumblings, and certain times biscuits and watermelons also you can take in a little quantity but not much. And then waffles, certain waffles, and then honey also we have to see and consume it. There are certain things called as maple syrup, usually you should avoid. Chips and ice creams, these are the extra things, and figs and guava, mango, papaya, all these are the certain fruits which you should be avoiding most probably if a person is suffering with the diabetes. And there's nothing to completely avoid, they can definitely take it, but thing is in a proper quantity and a proper meal they should take it. And getting up early morning, they can have as a natural remedies, they can have cucumber juice and then karela juice, or certain things they can definitely practice instead of coffee, tea and all. So the person can eat more tomatoes, peaches, strawberries, cucumbers and broccoli, and even milk also they can consume, and salsa, olives and eggs. All certain things also definitely help in developing the good health for the diabetic people. And almonds, all avocado, all certain dry fruits also will help in treating the diabetes, and this will be a good meal plan for the people. And then usually you can include the rotis where the low glycemic index will be there when compared with the rice, definitely help in achieving the targets of the good glycemic control. So instead of rice, a person can take rotis. Basically they can go for the millet rotis, and then they can include 1 cup of black tea or green tea, or 2 pieces of rusks also they can use, and 1 bowl of oats usually, or muesli what we'll call it as, with mild banana, not huge, the bigger one, a small one they can definitely consume. And they can consume cucumber and salads more rather than the normal rice and all. And in the night time they can always include boiled vegetables rather than going for the masala, spicy or oily foods. This all if you follow, the diabetes will be under control.